Hi, my name is David Rindge. About 15 years ago, I was just beginning to go into private practice. I either had my acupuncture license in my pocket or it was probably in the mail on the way to me when I attended a state association conference in which lasers were presented. I was pretty interested in laser therapy from the beginning, and there were a couple books that were at the conference. I got absorbed in the book and I missed the part in the lecture in which they explained you can't do this because FDA hasn't granted permission yet to do this. And I saw that the science was there to support laser therapy, and I was thinking that, well, you know, if I did get a laser, I could probably treat my mom. I could really help her and maybe address some knee issues. You may recall that my mother had worn 3-4 inch heels for 40 years. My mother was a very good-looking lady. She ate well, she lived a long time, and she really took care of herself, but she wanted to be 5'6", and she was only 5'1½". And she did it, she succeeded at doing it, but the result was that the bones in her knees, the bones in her feet, really seriously altered. And so I got a laser, and the first time I treated her, pain was gone. You got to realize that my mom was told that she was never really going to be able to address the issue. And even though the pain came back a couple days later, and I thought, okay, well, maybe I'm just making her feel good, my mom continued to respond really well to laser treatment. My mom lived about 40 miles from where I am, and so I would see her sometimes every couple weeks, sometimes maybe even twice a week. I went down about 2 months in, and Mom said, "You don't need to do anything, my knees are fine." Now you got to realize my mom was bow-legged, but she was never slowed down from that day on. Following that, we realized we couldn't bring laser therapy directly into clinical practice. So we needed to create what was called an investigation review board. And in the year that we created the IRB was prior to laser therapy being cleared. A lot of acupuncturists in the state of Florida began practicing with lasers. And I'd like to think that maybe we had something to do with the next year the FDA beginning to clear laser therapy. In that time, continuing to use this stuff, I've been more and more amazed because the applications go way, way beyond what I had thought they did. Again, the applications are huge. For anybody dealing with an issue, the worst thing that can happen is that nothing happens. And for many clinical issues, laser therapy is an answer for prayer or of something that you didn't know you might actually be able to achieve. I've been in healthcare most of my life. I started out as an equipment technician in respiratory therapy, became a respiratory therapist, a lab tech. I worked for a long period of time as a perfusionist, a person who operates the heart-lung machine in heart surgery, and also have worked as a registered nurse. Again, I'm still in awe of the promise of what I see for this treatment. When it becomes incorporated across the board, it promises to lower healthcare costs and to raise the quality of care that people are receiving. It's very simple to apply. The therapy, which causes the regeneration of tissue, tends to have an endpoint. It's not endless. You're not going to be taking something just so you can function. But at a certain point, treatment's not going to be necessary any longer, since it absolutely does cause regaining of function and regeneration of tissue. So we have all the tools here and now to bring healthcare to a higher and better level, and to make the practice of medicine safe and better. Yes, and we have 2 websites. I encourage you to visit the clinic website, which is cooperativemedicine.com, and also to visit the educational seminars in laser therapy devices and a site, which is healinglightseminars.com. Both spelled as they sound, healinglightseminars.com. Thank you.